My nonprofit organization is the Endometriosis Foundation of America. Endometriosis is a chronic disease where the lining of the uterus grows outside the uterus and can spread to other organs in the body. This can even include the chest cavity, putting the heart and lungs at risk for scar tissue and lesions. The disease causes disabling extreme pain as well as other organ failures. 1 in 10 women have endometriosis, but it takes up to 10 years to receive a diagnosis and treatment. The only known treatment is surgery and pain management. The Endo Foundation is dedicated to awareness, education, and funding research towards endometriosis and prioritizes community interdependence. Their mission statement is they strive to increase disease recognition, advocacy, surgical training, and endometriosis research. They also have an emphasis of the critical importance of early diagnosis. Early diagnosis can prevent infertility. As someone with endometriosis, EndoFound is an amazing organization that helped myself and many women find the resources and support for diagnosis and treatment. They have created a community for women to share their stories, as well as provide ways to participate in community outreach, volunteering, career opportunities, all seen on their website to the right. What they are most known for is their Endo Education program, which raises awareness and promotes treatment-seeking behavior through interactive lessons. So far, they have conducted 1,200 lessons, educating 38,000 adolescents. An educator shares her story with the student, who explained that her doctor thought her painful discomfort was normal and she would grow out of it. Unfortunately, this is a very common response endo patients receive from doctors. I was once told endometriosis was a myth disease by my doctor. The program gave the student the confidence to listen to her body and take control of her health. Although this is an amazing growth for that student, it shouldn't be her responsibility. I would love to work with the educators program to further discuss and assist other endo patients to seek the treatment and diagnosis they deserve. Endometriosis is a perfect way to correlate feminism and intersectionalism with women's healthcare. 1 in 10 women experience the excruciating and chronic pain of endo, yet little research has yet to be conducted. Diane Hoffman from Maryland School of Law compared multiple studies of men and women's pain. In 3 of those studies, women were significantly more likely than men to be undertreated due to pain, rating at an odds ratio of 1 to 5. We know from Collins' Black Women's Standpoint and Crenshaw that Black women are at most risk in the healthcare industry. With a disease that takes average 8 to 12 years to even get diagnosed, Black people are even less likely to get an endometriosis diagnosis or treatment. A study by the American Journal of OBGYN stated that 40% of African American women were told they had pelvic inflammatory disease, a sexually transmitted disease, when all in reality they had endometriosis, leaving them undiagnosed for years on end. In conclusion, the Endometriosis Foundation of America is a nonprofit organization that provides education, community interdependence, and research funding. Endometriosis is a chronic disease that affects many women in America today. It can be recognized through feminist thought and Black women's standpoint as a woman's health is neglected.